Welcome to Healing with Her, the podcast where women in medicine share bold and honest conversations from the front lines of healthcare. Step into the world of Black women medical professionals as they unpack the power of healing, the weight of care, and the beauty of showing up whole.
Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the front line of healthcare. I'm your host, Dr. Julie Sosa, and I'm thrilled that you're here. Whether you're a healthcare professional, someone passionate about wellness, or someone who's looking to gain more knowledge about your health and well-being, you'll find stories here that resonate, educate, and inspire. This podcast was born from a shared truth. Healing isn't just about medicine, it's about connection, listening, and leadership. And who better to lead those conversations than women physicians? Our disclaimer is that the information shared here on Healing with Her is intended for educational and information purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by the hosts and the guests are their own and do not necessarily reflect those of their institutions or employers. Hello, everyone.
Hello.
We are back again and very excited to have a wonderful guest with us tonight. We have Mr. Broderick Cason.
Yes.
Did I say it right?
You said it. You sounded really good when you said it. Yes.
We would love for you to introduce yourself. We're so happy to have you.
As mentioned, I'm Broderick Cason. I manage community engagement for Univera Healthcare. I live in Buffalo. I've worked for the health plan a little over 10 years, as we talked about prior to this evening. I have worked for other parts of the health plan prior to coming back to the insurance side. Mm-hmm. So I was assisting in some of the recruitment when we used to be what's called the staff model, which means we owned the practice model, and we also were a health insurance company as well. So you utilized our facilities and you had our healthcare coverage. Mm-hmm. One of those, Dr. Nylander used to be one of our physicians, and we had Mosier Medical Center on Carlton in Maine. And so I was recruiting physicians for the health plan for a while. And then I came back to the health plan, so it'll be 11 years this coming April. I do a lot of work in sales and marketing. My job in community engagement really is to do things such as we're doing tonight. And my main focus really is to give people education about health insurance, about the importance of it, how it works, the expectations one should have about how to navigate the system. Hopefully, once they've obtained health insurance. Just as a sidebar, which we probably talk about later, one of our main focuses that I'd be remiss not to mention is recertifications. So we spend a lot of time talking about recruiting and referrals to us for prospects to become members of the health plan. And that's great. Of course, we want to gain membership and growth. The hard part is not just recruiting a member, it's retaining one. And one of the big focus areas is retention as it relates to people who have to recertify. And in all of the programs that we're going to talk about tonight, there is a recertification expectation. It has a deadline to do so. It typically is annually. And there is information that's sent out to people prior to, and ample time for them to recertify. We do have people that are sometimes transient population. As you know, we have a lot of new Americans, so we're always sensitive to language needs to get that information out there. I think that as providers, you all are significant to recertification. Why? Because trust is the number one thing.
Yeah.
Health plans are only going to have a certain level of trust because we're the health plan, we're the insurer.
Right.
We spend, though, as a sidebar, a lot of time, our tagline is here for you, in getting into the community so that people do understand that in addition to covering lives, we care for lives. We enjoy the opportunity to provide people with equity, opportunity, and we have some equity grant opportunities for providers to do things that will bring together clientele, typically of people who would not normally have that opportunity. And they live in communities of color. And how do we resonate to those folks? So we do a lot of those types of things. So my job really is to make sure that we're everywhere we should be. And what are we doing when we're there? How do we present? And what did we learn from presenting in the community? What things did we find out that we could do better, that we should continue to do? Listening to what people have to say is vital.
Yes.
I'm happy to say that I believe we have really garnered real trust in the community as it relates to that. We can do more, but it comes with the work that I do about being, as I mentioned, places where we typically wouldn't be. Tonight is an example. And so you have to really be nimble, you have to be flexible, you have to be passionate about wanting to make sure. And we talked a bit about this previous to our discussion right now, and that was really about the idea that in addition to trust, it is the idea that people really need to feel like it's genuine.
Yes.
And sometimes that's hard because, they see you as the insurer. Do you genuinely want us to be enrolled in your company, right? Well, it's more than the enrollment. It goes back to what other things in like a whole person-centered care way can case management be involved? Can marketing be involved? Can pharmacy be involved? So the idea that we look at an individual when they become a member, what are those things that we need to make sure we impart on them? And education is the number one thing.
Yep.
Unless you do that, and it's complicated.
Yes.
It's hard,
It's very
right?
complicated.
And it changes very often. So we never feel like we know everything, because what you thought you knew last week, particularly in the environment we're in now, it really is a matter of staying focused on the work, but also to be open and keep your ears open, your eyes open on what's happening around you, so that we can then impart that on the people who aren't in the room. The goal for me is the voices that are not in the room. So are you making sure that they're heard and they're seen, and not necessarily physically heard and seen? You know that what you're talking about is about people that aren't in the room. And are you being sensitive to that? And thinking like, what would I want for my care? What would I want for my family? And it's not that hard. I start with the Serenity Prayer and with the Golden Rule. And if you make those two things your platform, we can figure the rest of it out.
Well, let's, I'm sure there are a lot of questions about what, we're in the season of open enrollment.
Yes.
And the reason why we decided to have this episode is that, again, we are physicians. We talk a lot about individual health. But in this country, in order to get access to healthcare, you have to have insurance. And for many folks, you may be getting insurance through an employer, but sometimes you're not. And this season of open enrollment is the time where, one, we need to be aware, we need to be educated about what is out there. We need to know the deadlines, we need to know how to sign up. So for those of us who don't know or who aren't familiar, what exactly is this open enrollment season and why is it important?
Well, let's start with why it's important, and I think we talked a little bit about that. It really is changes the quality of people's lives, having health insurance. I don't think people put health insurance really in the category of importance that it really needs to be. And part of that is you don't really think you want to buy something you don't think you need until you need it, right? So this goes back to education about why, in fact, I need to be prepared for what could be. It's insurance is just in case.
Right.
No different than car insurance, than homeowner insurance. It's just in case. And you probably know that the number one reason for people being in financial debt is not credit card debt, it's medical expenses.
Yes.
And that triggers a whole number of other issues once your credit's bad, right? So the idea of the importance of it is more than just so I can see my doctor. The importance of it is so that you can establish peace of mind that when it happens, and life is going to happen, that's not one of the barriers that takes place immediately. And we spend time, as I mentioned before, about making sure people are aware of the deadlines, as you mentioned, and the process. So basically, the state has an enrollment period that is sort of well publicized that you'll begin to see commercials about and radio, and that begins November 1st of every year. And so the people who are taking advantage of open enrollment time are people typically who are going to be enrolled into insurance during the fourth quarter, leading up to beginning with their insurance coverage for January 1st.
Okay.
Now, mind you, that is really the linchpin to all of our products, generally speaking. So commercial, as you mentioned before, which are people who are employed. A new group comes to us. Of course, they're going to enroll at the time when they become members, regardless of what the month is. But most of our commercial employers do that January 1st. They come aboard brand new. They make choices to switch from another to us or to change some of their benefit structures at that time. So that is happening whenever they become a new group. But generally, January 1st is when even our commercial groups. So I say all that to say there's a lot of things happening in the last quarter of the year for all of the products. Medicare, which you know is for an individual who have two scenarios. One is they're turning the age of 65. We call those age-ins. Or they have been disabled 2 years or longer, and that makes them eligible for Medicare. So that could be someone who's in your practice, who you see and goes through the billing process, et cetera, and you find out that they, in fact, are on Medicare as well. That's because that their situation has been in terms of disabled for 2 years or longer. So their open enrollment period begins on October 15th, and it goes to December 7th. So we're about to approach that. As a matter of fact, today is the first day by federal requirement that the health plan can begin to talk to consumers about specifics. They just can't close the deal in terms of people signing an application until the 15th of the month.
October. Okay.
So that's a quick turnaround. So we do a lot on the senior side with this, with senior centers, with health fair and intervention. We have, for the products, we have retail. We call it a retail center. It is in Park Club Lane, which is our headquarters, 205 Park Club Lane. And that is Monday through Friday from 9 a.m. to 4:30 p.m. People can make appointments preferred, but they can walk in. They're going to see a consultant for any one of the things I've already described or I'm about to describe to you, which would get them connected to their insurance without the barrier of where do I go, what do I do?
Right.
There are other ways people could enroll. They would contact, and I have phone numbers that don't let me forget. I can kind of tell the audience, but we have what's called Qualiphone. And Qualify Phone is where people call in and they get the information that they need and they can enroll by phone.
Okay.
Prior to COVID and out of the COVID world, most people now are beginning to want to do that face-to-face. We encourage face-to-face because it's what's called an individual sale. And I get to look at you, I get to establish trust, I get to do those things when you're physically sitting in the room. It's a comfort level as well. So people can do a few ways, but we primarily talk about people making appointments and coming in to see us. So that November 1 number for people who are under the age of 65, there are individual market, and they would be coming in for insurance enrollment, as I mentioned, for the next few months leading to the beginning of the month. So someone could come in November 1st. The other deadline that's important, that throughout the year, regardless of open enrollment or not, someone is new to one of our products. We'll use Medicaid as an example. They're new to Medicaid. They're on Medicaid. They're joining our plan. They can do that at any time throughout the year because it's Medicaid and it's not based on calendar year. It's based on enrollment year. So they would recertify with us, so they'd have a year from their enrollment date. There are other products like Child Health Plus that have a deadline of the 15th of the month to be enrolled the first of the following month. So from November 1st to November 15th, we encourage people not to wait till the last minute and show up on the 15th. They can do that, but that's just not preferred. Because they may have documents that they don't have. There may be things that may transpire, and they're at a real deadline clock at that point. Yeah. So we tell people to do it early. And so we try to get people to understand about the 15th because that's critical to enrollment. So there's the Medicare dates, there's the New York State enrollment, November 1st date, the idea that the deadline to enroll for many of the products is the 15th of the month. So just a real quick synopsis of what that looks like. So Medicaid, as I mentioned, people obtain Medicaid. They're going to join what's called Medicaid Managed Care, which is provided by the health plans. And they're going to get enrolled. And then when they do that, they would have recert once again a year from there.
From then.
Okay.
People who are in Child Health Plus, which is a program for a child who is a newborn up to the age of 19. And I stress the newborn because in Medicaid, as you all probably know, a woman who's expecting a child could get Medicaid, even though that child is not born yet, and that child would be born with the coverage already. As opposed to Child Health Plus, where that baby has to be born, and then once born, we can enroll that child. So that child would go into Child Health Plus, which is not necessarily free. Many of the people we enroll because of income, and all of the things I'm talking to you about that's not Medicare, is driven by household size and income. And real quick for your info, the reason why Medicare isn't, because it's the only insurance to include commercial that you're entitled to. So people say, I'm supposed to get Medicaid. Well, you may not necessarily. It's depending on household size and income. And at any time that could change. You or your spouse have earned, by working 10 years into the system, Medicare. So it's the only program that is, which why you probably don't hear a whole lot about that product in the world today, because that has that promise, if you will, of enrollment if you or a spouse have worked. The other products that I'm talking about have those deadlines, and they're based on household size and income. So Child Health Plus pretty much mirrors by benefit the same things as Medicaid. which the exception of, as I mentioned, that child has to be born prior to enrollment. Unlike Medicaid, it is not no cost necessarily, but many of the people that we enroll are zero premium, and it goes up to $15 and up from there. We have very few people that are in full premium.
Can I interject?
Sure, please.
The terms premium, deductibles.
Yes.
What do those mean?
Okay. Premium is what you pay up front, similar to car insurance. It gets the insurance started. So you're paying a premium that is agreed, because it's a contract, really, between the health plan and you, and you know what that dollar amount is, and that's expected every month. Deductible is a dollar amount you spend, and once you've spent that, so the services that you're going to incur, I'll make this up, is $2,000 deductible. Your $2,000 is out-of-pocket expense to equal the $2,000, and then it reverts into sort of a copay kind of a situation once you've reached the deductible. And we're required to send you information to show you each time you've used a service, and you get info from us in the billing piece. It will show you of the service rendered, what's your portion, how much came out of your $2,000 deductible, and what's left. And you'll know that until you've reached it. So
That's
it's very
that
transparent.
explanation of
So
benefits. That
yes.
EOB
Yes,
that you get.
there you go. Yes, EOB. So it's transparent, and you know what that is. Copays is where you're going to pay that amount out of pocket when you visit the physician and specialists. It's transparent. You know that at the time that you take the benefits, and it's spelled out for you what that opportunity for that cost is. And that is a fixed amount. So you're not going to suddenly show up and it's more than what your copay is.
Now, when an individual is trying to make that decision, so you mentioned having different products, what are some things you'd recommend they consider as they decide what products may be good for them outside of age? I know you had mentioned household size, income.
Yes.
Are there any other things as an individual should think about while they decide which plan is right for them?
Yeah, that happens more in, which would be another one of our products, what's called qualified health plans.
Okay.
So they're affectionately known as QHPs. So qualified health plans have an opportunity to have 4 metal levels. And in the Affordable Care Act, otherwise known as Obamacare, they came up with the metals because they thought people would understand those better, platinum being the most expensive, followed by gold, silver, and bronze. So in those metal types, one of the things that is critically important but very good is the essential benefits. That means that every one of those 4, regardless to which one you picked, even though you paid the highest amount at platinum and the lower amount at bronze and everything in between, your basic medical services, benefits, are in every one of them. So that takes away any discriminatory, I paid more, you paid less, I get this, you don't.
I get more because I could
And there are 10 of
more.
them, and you'd be hard pressed when you see the 10 of things that are missing that you would really need. So that's a big benefit in the Affordable Care Act service. So the idea of, and I say that to say, it's not so much now where we have to talk about if you pay this, you get that. So the idea of what's in your best interest, most of that now is pretty well fairly covered. Yes,
That's
it
good
really
to hear.
is cost. And what does that look like in your pharmaceutical pay, out of pockets?
So your prescriptions.
Right. People sometimes worry about hospitalization, but it's a very small portion of the population that spends an overnight or longer in a hospital. And you all know that as physicians that there's a lot of other things that can happen, including a visit in the hospital. Colonoscopy is an example. And you receive that and sent home. You did not require an overnight stay. So most people who even go into a hospital are not admitted. So those are things that really are more around cost associated with the benefit package plan that you've chosen. Transparent, you are probably hearing a lot about the tax credits.
Okay. Yes.
All right. Well, long story short, tax credits are the ability for someone to get a decrease in their cost of the total cost of the benefit. So I'll make this up. So it cost $800 a month for the plan of one of those four metals you chose. What happens is, again, based on income, household size, it's determined that you fit in the qualification of half of that being paid on your behalf by the federal government to the state, and then that ends up in the health plan's hands. So we collect the four, you pay us four. Okay. So it becomes whole to the health plan.
Gotcha.
The concern is that is coming up. That was created in the Affordable Care Act. It had a 10-year period, and December 31st of 2025 is when it sunsets. It has nothing really to do with the things that you're hearing now. It was planned that way.
Yeah.
Yes.
With the idea that it could be extended past the end of this year.
Okay.
That is part of what the question is, whether that will happen. Failure for that to happen, I would be responsible for the whole $800. And we know many people won't be able to do that. So, that's one of the things I just wanted to highlight, because I know that's going to be in people's minds when they're hearing so much about qualified health plans. So that's kind of how that works.
All right. You have given us so much information.
I know it's complicated.
I think you're really breaking it down and making it clear. And thank you for that.
Thank you.
I wanted to get back to the point you made about the Affordable Care Act, sort of eliminating the inequities or attempting to do so, which I think is something really good, personally. And we could see where a previous barrier, right? Somebody may not choose to get health insurance because they presume I'll need to pay even more money if I need XYZ, but to know that there are these essential aspects that are covered no matter what, I think is something that we really need to stress to our audience, that even, despite, platinum, gold, silver, or bronze, you could have basic health care at least. And that is critical, important for your annual exams, perhaps your colonoscopies, all the preventive care, your pap smears, your mammograms. And so knowing that that is available is good.
It's great.
And really important for us to know. So thank you for that.
Yes, I will just add on the other product that I should really mention, along with the rest, is Essential Plan. So in the Affordable Care Law, it's referred to as the basic health plan. And then states could give it a name. So New York State gave it the name of the Essential Plan.
Okay.
So if you go online, I should also say New York State of Health is what the New York State website says.
Okay.
Going on there will give you instructions about how to get to us, the health plans that are available, those type of things. So in the Essential Plan, prior to your point about the benefits of the Affordable Care Act, prior to that, we used to turn people away because they made $2 too much for Medicaid. And we said, sorry, adult, we have nothing. You can put your kids in Childhood Plus. Your children are eligible for Medicaid, but you unfortunately are not. And you earn $2 too much. Okay. That went on for a long, long time. And so now Essential Plan is for a young adult at the age of 19 up to the age of 64. They are too young for Medicare. They're too old for Child Health Plus. I told you cuts off at the month of their 19th birthday. And they are not eligible for Medicaid. So what do we do with them? So this is truly a safety net product. So it gives all of the benefits we talked about and more. It includes dental and vision.
Okay.
And today, that is 0 premium.
Oh.
And today, it has a $1 generic, a $3 brand, and a $3 third tier.
That's pretty amazing.
As copays.
Yeah.
Yes.
Yeah.
And the third tier is the one that I always say, is that right?
Right.
Because you know, third tier could be a cancer drug, could be
Absolutely.
lupus,
Yep.
could be
Yep.
MS, could
Yep.
thousands of dollars in costs.
Right.
Yes.
Is $3.
I think you need to say that again so everybody knows.
Okay.
What?
It's called the Essential Plan. And it is currently offered by Univera and some of the other health plans. And it has the deadline of the 15th of every month for the first of the following month. It's based, again, on household size and income. The beauty of the program is to really catch the people who, for so long, we had nothing else to offer them. And those 4 metals that I mentioned, their income, they could not afford those.
Got you.
So what do we do with those people? So the other piece I mentioned is dental and vision. Well, in dental, it also covers crowns.
Oh, wow. That's amazing.
We have commercial
Insurance is that too?
we have commercial plans that
That
either
not.
don't, or if they do,
They're
they don't
very
pay at
little.
all.
Yeah.
Yeah.
Right.
Yeah.
So that is one of the other ones I had to say, are we sure that's right? And so I spend a lot of time as education talking to groups about Essential Plan.
Yeah.
Because I believe that's the one that's not the obvious. CHIP, Child Plus, is more obvious, more talked about. You know a lot
Yes.
about that one. Medicaid, of course, you know about. Medicare, of course, you know about. Essential Plan really is the one that people say, I never heard of that. And Broderick, for 5 years, I haven't had insurance because 5 years ago I was told I made too much for everything else. And now you're telling me I could get this in. And now, here's the other side, I have to tell you, of the coin. There are some concerns around how it's going to be funded. It's a significant portion of that product comes from federal money and a smaller portion from the state.
Yes.
The question is, if there is less from the federal government, can the state pick that up? We don't know.
Yeah.
And right now, it's not in danger for January 1st, but there are some changes that are taking place as we speak and going forward that have more to do with the folks who are DACA, and then the folks who are undocumented. What's that term mean? What is that going to mean to it? And all of that's in flux right now. I can also tell you that we need to be preparing to understand what's happening, but most of the changes you're hearing about won't take place until 2027. As health plans, that's not far off.
Right.
So we need to begin in 2026 to get our infrastructure ready to
Ready
do
for the
what
change,
needs to be done. So there's a lot right now even of reading through the stuff and what does this mean and what do we have to do? But the things you're hearing about for the most part, they're all concerning, but the one that's concerning to me is in January of 2027, they're talking about us health plans having to recertify people twice a year.
As opposed to once a year.
And I can tell you that it's difficult to get people to recertify once a year. So this twice a year thing will be challenging, to say the least. So, but again, the things could change between now and January 1st of 2027. Whether or not by the end of this year the tax credits will be, re-engaged. There's so much we just don't know that my position is it's better to tell the people we'll get back to you when we know more than to mislead people. Yes. If you don't know, you don't know.
Right.
And as you know, there's so much information right now, and all of which is not necessarily, when you hear it on the street, accurate.
Not factual, yeah.
Right? Mm-hmm. So you have to, where are you getting your information is huge. Mm-hmm. And so we try to make sure that if we're going to say we're the go-to, and we're, the consultants that we really are, that we've spent time with the information, we know what we know, but we know what we don't know, and everything else in between.
Now, would you recommend, given the fact that there's so much unknown and, a lot of things have potential to change in the coming months, would it be beneficial to really, now maybe a good time to get enrolled? Because at least you're locked into that contract for the next year. Whereas if you don't have the benefits that we have now, choosing to enroll later on, you may miss out?
Yes. For that and the myriad of other reasons that we talked about, yes, you would want, knowing that what I've presented today may change, you want to be in. Now, that does not mean that a year from the time you've done that, it changes. But we don't, as a rule, a couple things we don't do as health plans. We don't enroll or disenroll people any other time than the first of the beginning of a month you're in, and the end of the month. So if it were right now and I was being termed for whatever reason out of the product I'm in, that would have happened yesterday.
Okay.
And today, October 1st, I no longer have that previous coverage I had. We would never do that during any other day of the month. So the idea that whatever I'm signed up for through the course of that year isn't going to change. They're not going to pull the rug from under me in the midst of the year. Now, what will make that statement not so certain goes back to recertification twice a year.
Right. Yes.
Okay, so and make the dates work. You got in January 1st. Well, June 30th. Right now, you got to recert. Your recert will say yes, you're still qualified for that product or something else. And then July 1st through the end of the year, you've satisfied the requirement to know that you're still eligible for the next 6 months. Failure to do that, you could be termed in the world they're talking about now, mid-year.
Okay.
Because you have not satisfied the next 6 months. Now, the work requirements you're hearing about, too, that won't happen until January 1st. If it does, of 2027, that will require people who are on Medicaid, who are working. And there's a list of exceptions.
Okay.
But the core of those people would need to report their working to keep their insurance coverage. And the questions are out there about what does the recording of that look like? Who's doing that? Is it the employer? Is it the individual? Is it both? And the misnomer, to clarify today, is that most of the people on Medicaid, adults, are working. So this idea of John Doe sitting on the couch, watching The Price is Right. No, he or she is out working. Yes. And one of the big problems is wage equity.
Okay, so that's a whole different conversation.
Right. So it's not,
from three women,
right,
probably.
Right, understand, right. So
really understand that.
Yes, so it's right. So it's not that I'm not contributing. It's to be able to raise my family and do the things that all of us want to do, the American dream. People have to be paid fairly for their work. And that becomes one of the issues around not being able to afford health insurance. That's where I was going with that. Yeah. Because miss a meal or pay my insurance.
Right. Tough
Particularly
choice.
if you're a senior who is on a fixed income.
Absolutely.
My number didn't change of what I get because you raised the food and gas right. So those things go back to the whole, which is another thing we could talk about at some other time, but the whole social determinant thing. Those things weigh on insurance, right? It's one of the things that's out of the way. So I know people are struggling with a huge number of other things. The one thing that we can take off their plate, generally speaking, is health insurance. You know, it does change the quality of people's life. It's one of those things that you don't have to worry about once you get it. It's also, like I said, harder to get young people invested in health insurance. So we're always thinking about what are the ways to bring them in, you know, to educate them, to make them understand that, once again, it's just in case. And people don't want to pay for stuff they don't feel like they need.
So true.
So until the time arrives.
So that's in that too.
Well, Broderick, we are so happy to have had you here tonight. You have given us a lot of information that was really critical at this time in particular. And this conversation could go on and on.
It could go
on
and on.
We'll definitely have to have you back for that.
Okay.
So tell us one last time, if our audience needs to get enrolled, where can they find you and how do they do that?
Okay, so there are a couple of ways. So phone numbers, if they are under 65 and they're looking for one of the individual products that we talked about, the number is 1-800-817-6700. So that's 1-800-817-6700. And we have a couple of our ladies who are facilitated enrollers. They do consult with people to help them sit down and enroll. One of them is Mayette Ferguson, and her number is 716-346-3241. And the other one is Kimberly Burr, and her number is 716-536-1737. And they are available in addition to, as I mentioned, people who wanted to make an appointment or walk in Monday through Friday between the 9 and 4:30 time frame. They can still always do that Monday through Friday. But
where's that address?
205 Park Club Lane, and that it has a Williamsville address, but we always say it's 20 minutes from everywhere. So we fortunately have not heard issues about people being able to get to us. But Kimberly and Mayette are really very well-versed in everything I just told you. So they know individual market. They also dabble in Medicare. So they can help people to figure out, to your question earlier about what's best for me. That's what that consultation is about.
All right.
Good.
Thank you again. And thank you to our audience. Again, we are Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the front lines of healthcare. I'm your host, Dr. Julie Sosa. I have with me
Dr. Pamela Reed
and
Dr. Amikule Nylander.
And tonight we had our lovely guest,
Broderick Cason.
And just for a disclaimer, the information shared tonight is intended for educational and informational purposes only. It is not a substitute for medical advice, diagnosis, or treatment. Always seek the guidance of your physician and or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by our hosts and guests are their own and do not necessarily reflect those of the individuals or their institutions. Thank you for joining us again.